Hello, welcome to Talk Sessions, and we're going to be talking about chronic kidney disease today. My name is Dr. Theophilus Umeizudike. I'm a consultant nephrologist. So we define chronic kidney disease as irreversible destruction of both kidneys that takes place over months or years. So we can stage chronic kidney disease into 5 stages. There's the stage 1, there's stage 2, there's stage 3, there's stage 4, and stage 5. And this is usually based on a calculation of what we call the estimated glomerular filtration rates. So stage 1, this glomerular filtration rate is 90 and above, while stage 2, it is from 60 to 89. Stage 3 is from 30 to 59. Stage 4 is from 15 to 29. And stage 5 is less than 15 or 15 and below. And usually when this happens, chronic kidney disease, we see that such people are not able to perform what they normally do. And usually we look at chronic kidney disease strictly as people whose estimated glomerular filtration rate has gone below 60 mL per minute. But because we have a myriad of people that may have early forms of kidney disease, which may most times be asymptomatic, that's why we have come up with this classification. And so this classification came up in the year 2005, and it's been modified from time to time since then. But by and large, it also has helped researchers worldwide to be able to speak the same language. We no longer use the term chronic renal failure or any other term. Rather, we stick to chronic kidney disease, and it helps us wherever you're working in the world as a kidney doctor. When you mention chronic kidney disease stage 3, 4, or 5, people know what you're talking about. And so it's helped us to unify terminologies among health workers and also among researchers and among kidney doctors all over the world. And so when this terminology came into being, it also has led to being able to say what are the things that will cause chronic kidney disease. In our environment, most of the people who have chronic kidney disease is as a result of long-standing hypertension, which is quite prevalent in our environment, and statistics latest shows that between 20 to 30%, or some studies as high as 40% of Nigerians actually have hypertension. And oftentimes the hypertension is something that is undiagnosed. There's a rule of 3 which some researchers have described, in which a third of people actually know that they are hypertensive. Yeah, and out of that 1/3 who know they're hypertensive, only about a third are taking their medications. And out of the third that are taking their medication, just about a third are controlled on their medication. So there's that rule of 1/3 that has been described by researchers. And if you look at our climate where people don't seek health care because of the exorbitant cost or because of the perception they have about healthcare providers, they rather will think that, oh, this is something that they can wish away or say, oh, God forbid it will not happen to me. Hypertension has been described as the key cause of chronic kidney disease among Nigerians and in many parts of Africa. Aside from hypertension being the #1 cause of chronic kidney disease, we also have a condition called chronic glomerulonephritis, which is inflammation of the kidneys that can arise from myriads of infections that affect the body and that will ultimately affect the 2 kidneys. Hypertension and chronic glomerulonephritis are the leading causes of chronic kidney disease in Nigerians. The other cause of chronic kidney disease is type 2 diabetes, or diabetes in general, because the commonest of the diabetes is type 2, which tends to run in families linked to obesity, linked to sedentary lifestyle, and many other habits that people imbibe because we're adopting the Western lifestyle. And going on from there, chronic kidney disease can also be caused by conditions like autosomal dominant polycystic kidney disease, which is the commonest form of inherited genetic disorder that affects the two kidneys. And this is a condition that we are beginning to see in our environment because of the access that people have to sophisticated equipments to be able to pick up these cysts in their kidneys at an early age. Aside from that, there is also the scourge of human immunodeficiency virus that has been with us from more than 30 years now. And HIV is a known cause of kidney disease. And when people who are diagnosed with HIV don't use their medications, they may progress from just HIV infection to HIV affecting their two kidneys. Aside from that, other viruses like hepatitis B virus or hepatitis C virus has also been shown to affect the kidneys. Also, we know from coronavirus infection that this virus, though said to be novel, can also affect the kidneys. However, because it's still a novel virus, it's not been shown whether it can actually cause chronic kidney disease, but literature has it that it can precipitate some form of acute kidney injury, and for those that have chronic kidney disease, it can actually worsen their condition. Also going from there, there's the insult that kidney stones does have on chronic kidney disease. People who have formed stones or who have had kidney stone in the past, if it's not well treated and cared for early enough, can progress to have chronic kidney disease. Same goes for people who have urinary tract infection, women especially, and also men. So if a urinary tract infection keeps recurring because of many reasons that has affected those urinary tracts, then those people may be at risk of having chronic kidney disease. Then also there are children who are born with congenital abnormalities of their urinary tract. This also is a known cause of chronic kidney disease in childhood. And then there's the nephrotic syndromes or the glomerulonephritis that can affect any age, whether the young, the middle age, or elderly. Any of these that happens at any point in time can be a risk factor for people to develop chronic kidney disease. Then in women who are in their reproductive age group, they are at risk of what is called connective tissue disorder. The commonest one of them is systemic lupus erythematosus, which is called SLE for short. And so these conditions are been described in which the body in such people fights against themselves. And in fighting against themselves, they tend to attack and have a predilection for the kidneys as well as many other organs in the body. But one thing is, if these conditions that I've listed are detected early enough before they've caused irreparable kidney damage, it's likely that the people who have that early diagnosis can be treated well enough and reduce the risk of them progressing to chronic kidney disease stage 5. That's part of the reason why we're bringing this topic on talk sessions, to let you see that you need to change your health-seeking behavior. You need to give yourself some form of lifestyle changes beyond exercise, reducing your salt intake, taking enough water, taking fruits and vegetables. Look at also giving yourself some kind of birthday gift to do some health check, to check your blood pressure, your blood sugar, your lipids, your blood counts, your urine. Many people, when they're not feeling or when they're feeling unwell, they just decide to do malaria and typhoid. And many times, some of those malaria and typhoid diagnoses may not actually be the true diagnosis. But if you're able to get to check these things that are listed from a reliable healthcare worker and from a reliable health institution, you will discover that if we pick these things early, we may be able to reduce the risk of this disease progressing to chronic kidney disease stage 5. Join me next session when we'll be talking about more on kidney disease and how it affects hypertension and how it also, the relationship between chronic kidney disease and the heart. It's been nice taking this topic, and I'm hoping that you will join us in more sessions, and that this will go a long way in helping you change the way you view kidney disease and the way you take your health needs, and hoping that it will cheer you and propel you to adopt more healthy lifestyles that will help you to live longer, help you to be an encouragement to your family so that you don't become a liability. My name is Dr. Theophilus Umeizudike, a consultant nephrologist, and this is Talk Sessions. Let's talk about it.